David Wolfson. Hi. Good morning. Welcome to the Indy Boomer Show. I'm Mary Pat McKee. I publish a magazine called Indy Boomer. I am sitting here this morning with Jill Rusk, who is, let me get this straight, the Director of Business Development at Cardon and Associates. Jill has been with us before on the show, and it's always great to have her here with us. Before we get started, though, we got a couple things we need to take care of. Well, first of all, we always like to thank Jim Wofford Theater, Logan Street Signs and Banners for this opportunity to have our show, and we are very grateful for that. Jim has got a food drive coming up. And it is going to be August 15th from 9 to 1 p.m. All you have to do is come here to the Wofford Theater, which is on South 10th Street, actually 1720 South 10th Street. You bring some food, and guess what? They're going to give you food on the way out. There's hot dogs, drinks, free popcorn, that kind of thing. So if you can, please bring some canned goods. It helps the Hamilton County Harvest Food Bank, which actually supplies about 23 food banks in Hamilton County. It's a great cause. So hopefully you can do that. Jill, as I said, is here with Cardon. I'm very close to Cardon. My mother lives at Hamilton Trace and Fishers, and it is a great facility. One of the things I want to talk about real quick is that we did kind of a special. The last time Hamilton Trace was here a couple of months ago, we had some folks talking about the Reserve, which is going to be opening there at 116th and Cumberland, of course. And so we did a special little edition in the magazine, and it also kind of kicked off a new section that we are doing in the Boomer, and that is a Boomer resource guide. The reason this magazine started 5 years ago, just to remind a few people, is because my folks went into a retirement facility. My brother, my sister, and I, we all had to figure all this stuff out. We had no idea what we were doing. I saw all my friends around me dealing with the same scenarios of trying to take care of their parents. And what we want to talk about today, or what you can talk about too, Jill, is the connectivity that Cardon is way ahead of the curve of bringing community healthcare providers together. And tell us more about that.
As you mentioned, we've both walked this walk with our parents.
Yeah, I know you have too.
And as you said, we don't know what we don't know until we walk through that.
Mm-hmm.
And so what we found is so important is not only the building to be aesthetically pleasing to the patients and the families, but also the connectivity between healthcare partners.
Yes.
Because as your loved one may come from the hospital or an acute care setting, transition through the rehabilitation and then on to home health or home.
Right.
Who connects those providers? Because who carries that care
from the
plan
hospital
message?
to the
Exactly.
facility to, yeah.
And so our job is we wanted to make sure that we went back and we partnered with the hospitals and that we were able to build those bridges, because often there are many things that don't always get communicated.
Right.
We can always improve our communication. So one thing we did was we have all electronic healthcare records. So with the HIPAA
So you were,
compliance.
okay, I was just going to say, so
yes.
with HIPAA, you were able to bring that together.
Yes.
Okay.
So we have electronic records, so we can then share that information with the physician at the hospital, the physician that is sending the patient from the hospital, and then again send that total package of information on to the next care provider. So there's no gaps in care.
Right.
So there's no redundancies or gaps. We make sure we better care for our pets.
Well, and something I was frustrated with, my family was frustrated with, is a lot of times they change the drugs between the hospital and maybe what they were taking. And a lot of times the transition, somebody falls or whatever, is typically how retirement assisted living comes into play because they're no longer safe at home.
Correct.
So does this help that drug situation? Do you understand what I
Absolutely,
mean?
and I find that sometimes there's polypharmacy as we get into the geriatric population. You may have your mom will see one physician, her primary care physician,
Right.
go to the hospital, get another set of medication orders, and then see our physician, and they have medication orders. So it's bringing that together and doing a medication reconciliation to say, what does mom have at home? What did mom get from the hospital? What did
Right.
she get from her doctor? And looking at all those medications, how do they interact with each other? What's safe, what's not? And then being able to go through that so that she does have a consistent, safe list of medications.
Okay.
And that's critical.
Okay.
Because there's lots of times that there's interactions. And when there's interactions, then there can be confusion, falls, and other things that could add to illness or injury.
Well, and you're a nurse practitioner as well.
I'm a nurse. I'm an RN.
You're an RN. Okay, I knew you were an RN at least. I don't mean at least, but that didn't come out right at all. But anyway, I know you're in the medical profession and you know this. But is it true that as people get older and they're taking medicines that their body adjusts like a child? Like you wouldn't give a child Prozac. Well, maybe it would. I don't know. Shows you how much I know about medicine. But I see that, what my mom used to be able to take as far as medicine, she can't take that strong anymore. Does the body
it becomes
start
sensitive, and then
Yeah.
Everyone metabolizes medication differently.
as you age as well?
Yes, so it's
Okay.
very important to have the appropriate healthcare professionals involved in, like I said, again, doing the reconciliation. We don't know what we have at home, and often when I've done home evaluations, I'll find supplements and many other things and medications that are at home that they may still be taking. Didn't realize they were to stop taking it.
Right.
And it's very difficult sometimes for them to be able to understand what they're taking and put all that together.
Okay.
And we have many providers prescribing.
Right.
So it becomes very confusing. Can be confusing for healthcare providers, not only just, the patients. So that reconciliation is critical.
Okay. Well, and I would also think using the same pharmacy, because if you're using different pharmacies, they don't know what the other pharmacy
And that
is
is
doing.
with the whole electronic record that, our healthcare providers now are being able to share that. So you may have somebody that's getting medications from one pharmacy and another, where the two didn't know before, and now they do. They can look at that.
Okay.
And the same thing with abusive medications, so you're able to identify those things. So it's been very helpful in the healthcare field.
Oh, sure.
Once you know what's going on outside your walls with other people that touch your patient, together we can have much better outcomes and be better providers.
Right. Tell me a little bit about how Cardon is involved in the community.
We work directly with all the hospitals and have sit-down
Okay.
meetings
I
with
thought
them.
that you did.
And we talk about what we do, what we can do better, and what we can bring to the table. And often we think or we assume what the other provider does, but until you sit down and start talking through it, sometimes we realize it's the small things that maybe don't get communicated that are critical pieces.
Right.
And it's just like anything else. It's communication, and we can always better that. But when you're starting to have those face-to-face, and the walls come down and you become one, because
Right.
really we're there to take care of our community at large.
Right.
It's not about just acute care or just post-acute care or assisted living or independent.
Every part of it's
We
important.
work together because
Yeah.
that patient probably touches all those providers through the recovery process.
Well, and I also know, for instance, with Hamilton Trace, you have a continuum of care.
Yes.
So a lot of times folks will come in for the rehab from a fall, or I keep saying a fall, but I know a fall is one of the main reasons that folks...
Injury or illness.
Injury,
right.
yeah, exactly. And then they may continue on to maybe through the rehab, they're able to then get into assisted living, but then if something should happen in assisted, then they still have the skilled part. So it's the one thing I think is nice is that when somebody goes somewhere, they don't have to keep moving their home.
Right. They're all
And that
within the
becomes difficult.
community.
Yeah.
And usually what we find is within that community, you begin to build a community.
Right.
Your socialization.
Yeah, you know the people in
exactly.
there. Exactly.
A comfort
Mhm.
level with the caregivers.
Right.
And then you have the oversight. So we can evaluate and say, where are you safest? We want to keep you most independent
Right.
with your, dignity with independence.
Right.
But we want to keep you safe.
Yeah.
But if you moved from an independent apartment into, say, a skilled nursing facility, into our skilled nursing area, and neither of those entities spoke, we really wouldn't know you very
Yeah,
well, would we?
exactly.
So that's what's critical, that we all talk and that we're able to share information so we can better care for our loved ones.
Sounds good. You know what? We're going to take a quick break and
Okay.
come back. I forgot to tell everyone, you can now pick up Indy Boomer Magazine in all CVS stores in Marion and surrounding counties. So be sure and stop by CVS and pick up a copy of Indy Boomer. That is Debbie Knox on the cover too, by the way, in case you didn't know. Anyway, we'll be back in a couple minutes.
Everyone knows it's easy to find first-run movies in the big theaters. But where can you go to watch your favorite classic movies on the big screen for the perfect night out? Why rent a flick when you can rent the entire theater? Call today to reserve our 32-seat theater for your next event or just stop by to see what's showing this weekend. The 14 by 7 foot screen and the high quality digital surround sound system offers all the amenities you would expect from the big theaters with a laid back atmosphere and comfortable seating of your own home. Wofford Theater at 1744 South 10th Street in Noblesville gives you the classic movies you want with a big theater experience.
You know, when Margaret and I decided to sell the old estate here, we had only one choice in signage. Logan Street signs and banners. Conveniently not located on Logan Street anymore, but rather located on 10th Street on the south side of Noblesville. Well, we sold the old beauty, and we were able to buy this wonderful estate. And we had so much money left over, I was able to buy this beautiful 1968 Eldorado Cadillac for Margaret. Only 472,000 miles. Margaret loves it because it's got those big seats and that heavy-duty suspension to support her svelte frame. Next time you're looking for signs or banners, call old Jim at Logan Street Signs and Banners, 773-7200. Conveniently not located on Logan Street anymore.
Oversees the patient.
Yeah. Hi. Welcome back. Mary Pat McKee with Indy Boomer Magazine. You caught us talking. We always have really good
We do that well.
conversations. Yeah, we do that very well. And always have all these conversations on breaks that maybe we should be talking about now. Anyway, we're going to do a couple things real quick before we get back into what we were discussing. Indy Boomer Magazine, we talked about that. Debbie Knox on the cover of the July issue. Can be picked up at any CVS store in Indianapolis. Want to mention one more time because this is a very worthy cause. Here at Wofford Theater on South 10th Street in Noblesville, we'll be doing a food drive August 15th from 9 a.m. to 1 p.m. You bring the food, they're going to give you food. They're going to give you hot dogs, popcorn, drinks, that kind of thing. But it also is for the Hamilton County Harvest Food Bank, which supplies about 23 different food banks in Hamilton County. So very, very worthy cause there. I also wanted to mention, I don't know if you know this, Jill, but Hamilton County Radio, this show will be on Hamilton County Radio Monday through Friday at 6:30 p.m. for the next couple of weeks.
I was not aware of that.
Yeah, so hey, while I'm thinking of that, then can you tell folks the number they should call to talk to somebody at Cardon if they have questions about this, what we're discussing, or if they're interested in any of your facilities?
Certainly, and I will be glad to be a resource and an advocate to navigate through that process. And my cell phone number is 317-408-5159. And my email on the screen, as noted, is jrusk@cardon.us. And I will be glad to help navigate.
Sure, and if for some reason, like I said, if you're listening on the radio, if you didn't catch that, get the Indy Boomer Magazine, email me, call me, whatever. I know Jill, I know Cardon very well, and it's a great family of care for mostly boomers, parents, and that types of things. So anyway, hey, we were talking about, and I love the way you put this, so I'm going to say it, Cardon Care Connect. It's like CCCCC. So we were talking about how Cardon is one of the first leading the way in the industry for connecting the healthcare providers with the retirement facilities or other primary care doctors. Tell us a little bit more about that.
Not only, as I mentioned before, we try to bridge the gaps between care, because really we're wrapping our arms around the community.
Right.
We're taking care of our community. And that doesn't mean just what we do within our walls. That means that we join arms with all the providers and together take care of the community. And so we found it was very helpful with physicians. You have the primary care physician that possibly your mother or my primary care physician. But when I go to the hospital, that primary care physician doesn't always know what went on with that patient.
Right.
And so what we've done is worked very hard to pull that all back together and share that information then with the primary care doctor and follow up with them before they leave or transition to the next level within our company. We also employ hospital physicians because they're seen at the hospital, and it's important that that physician then, we found a lot of continuity with them
Doing
then
it that way.
seeing, coming over and seeing the patients in our buildings. There's a sense of comfort with families and patients saying, that's the same physician that saw me at the hospital, and knowing that he's following you into your recovery stay at
Right.
the rehab center. And we found a lot of consistencies also just with care. They've seen them, they've known everything that's happened, the redundancies aren't there. And how often as a family member do you go to someone and ask what happened, say, I don't have that information.
Right.
I don't know what happened at that other setting. And so having that consistency, there's a real sense of comfort with the families and the patients.
Right. Well, and that information, I'm assuming, I mean, we keep talking about doctors, but like, for instance, in the skilled nursing area where my mom stays, it's the RNs that are in charge. So is that information then filtering down to that level as well?
Correct.
Okay.
And then we actually do, it's different in each setting, but we actually do either calls or face-to-face meetings with doctors and the nurses.
Okay.
And we all come together and we discuss the patients and how they're doing and what we can do collectively. That's not just our facility, that's with the physicians and the people outside to say, as they move through the community, what can we do together to better help take care of them?
Right. Well, because I think a lot of times the families, once the person is either back in a facility for rehab or 24-hour skilled or whatever the scenario is, it could just even be going into the assisted living, is that who the family ends up talking to is not the doctor, it is the RN or the LPN who is on that area to help fill them in. So, I mean, the more educated, I mean, how long
And
have you-
involved are they?
Yeah, exactly. Because, I mean, we're not, as I already proved in the first segment, not medically trained, don't
Right.
even know the terminology
Well,
properly.
it's different when it happens to your loved one.
Yes.
You have emotion tied to it at that time, and it's often hard to make decisions.
Well, and it has to be broke down,
Right.
again, because there's people like me who don't understand what this drug does or what this means or what, any of that kind of information.
And what my insurance covers and
Yes.
how much does it cover, and always say it's like the hospital gown. We really don't know what all it covers or doesn't cover, do we? So we need to know that, and we need an advocate to help us with that.
Oh, very much so.
And we do putting transitional care nurses in our buildings, which are kind of the point of contact for the advocate.
Right.
That you can go, because wouldn't it be nice to know that you can go to one person and they can help navigate you through that?
Okay.
Rather than, we have all of the staff that are there, but, they have shifts and they work shifts and they go home. So
Right.
if you have one person and a point of contact during your stay that
Yeah.
you could call, the comfort that you would feel and knowing that you had that accessible to you
No, I
for all
agree.
your questions.
That's very, very important. So how do the doctors keep involved? Or I mean, I know you've talked about, do they... No, okay, let me back up, because the primary doctor doesn't go into the hospital anymore. And so they're pretty much dependent on what the
tell them.
the internist doctors in the hospital say. So how do they stay communicated? Is it just all electronic and they can get on their computer and say, okay, here's this person, I want to look them up, and this is all their stuff?
Most everyone has gone electronic to electronic health records,
Okay.
but we don't assume, and that's why we put these programs in place. Because when we assume, it
Oh,
often
yeah.
doesn't happen.
Yes.
So we take responsibility in pulling these people together, having those phone calls or those face-to-face meetings with not only the hospital physicians, the physicians that round in the building, but then also the primary care physicians as the patients, to keep everyone involved.
Right.
So we take that upon ourselves to make sure those meetings happen and that communication happens.
Right.
And we call that the handoff or handover from one caregiver to another.
Okay.
But if we
Okay.
take responsibility for it, then we make sure that everyone is informed.
Okay, that sounds good.
And that's been a wonderful program, because what we have found through that is there's many areas that we can always improve and help families with their needs and resources that we often don't know until we talk to the other providers.
Right. Jill, it has been a pleasure having you here. Time flies
enjoyed
here
it.
at Hamilton County
Yes.
TV, does it not?
I'll just have to come back.
No, I know. I hope that you do. Before we leave, though, I want to remind everybody that on Sunday is Boomer TV on Channel 8 at 10:30 on Sunday morning. Patty Spidler went out to Los Angeles and did a review of the Vacation movie. They redid that movie. Remember the movie
Yes.
Vacation with Chevy Chase?
Yes.
Well, they've redone it with his son now, so to speak, is the Griswold that goes to Wally World. It's hilarious.
We've all had a vacation like that, haven't we?
Yeah. Exactly. So anyway, be sure and watch us on Sunday morning, and also be sure and get to CVS and pick up a copy of the July issue of Indy Boomer Magazine with Debbie Knox on the back and Cardon and family on the back side.
Yes.
Or no, Debbie Knox on the front,
Front
and
and
Cardon on the back. Very good. Hey, everybody have a great day. We'll see you in a week. Thanks.